Hello po, magandang hapon po. Sa DOH COVID hotline po ito. Kayo po ba si Juan de la Cruz? Ako po si Case Manager C380 at ako po ang mag-handle sa teleconsult niyo po for today. Nirefer po kayo sa akin ng agent dahil sa iyong depressed mood, palpitations at difficulty of breathing. Tama po ba?
Opo.
Juan de la Cruz, 20 years old, male Roman Catholic student from Cebu City, sought consult due to palpitations, depressed mood, and difficulty of breathing. Patient is non-hypertensive, non-asthmatic, and non-diabetic. No food and drug allergies. No previous hospitalizations. He is currently living alone in a dorm for 1 year and 3 months. He sleeps around 8 hours a day. Activities of daily living is mostly studying and attending to online classes. Stressors include academics and living alone for a long time, with intensified isolation due to the pandemic. His source of support includes his family and close friends. Coping mechanisms include sleeping, watching movies, going out, but the patient claims that it didn't alleviate his symptoms. He didn't notice any weight changes for the past 2 months. He eats regularly every day, no changes in bladder and bowel habits. He doesn't exercise due to his hectic schedule, no vitamins and supplements taken. Patient is a non-smoker, occasional alcoholic drinker, and denies illicit drug use. Heredofamilial disease include hypertension and diabetes on the maternal side and hypertension on the paternal side. 2 months prior to consultation, patient was noted to have a depressed mood associated with loss of interest, hypersomnia, fatigue, feeling of worthlessness, impaired concentration, and thoughts of death. He attributes this due to being in isolation for 1 year and 3 months and academically induced stress. No fever, weight change, psychomotor retardation, insomnia, nor agitation. 2 weeks prior to consultation, symptoms persisted. Patient claims to be nervous and anxious nearly every day. He wakes up every day with palpitations. Patient is not able to stop worrying about different things every day. Patient has trouble relaxing and feels afraid as if something awful might happen to him most of the days. No fever, weight change, psychomotor retardation, insomnia, nor agitation. On the day of consult, symptoms persisted. Thus, the patient sought help. It is clear to us that Juan de la Cruz has a mental health problem, and that's our topic for today, specifically the National Mental Health Program. But first, let's define mental health and mental health diseases. Mental health is an integral and essential component of health. The World Health Organization Constitution states, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. An important implication of this definition is that mental health is more than just the absence of mental disorders or disabilities. Mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. Mental health is fundamental to our collective and individual ability as humans to think, emote, interact with each other, earn a living, and enjoy life. Mental health diseases, on the other hand, refers to a neurologic, psychiatric condition characterized by the existence of a recognizable, clinically significant disturbance in an individual's cognition, emotional regulation, or behavior that reflects a genetic or acquired dysfunction in the neurological, psychosocial, or developmental process underlying mental functioning. This is based on the Mental Health Act. The World Health Organization estimated that 154 million Filipinos suffer from depression, 1 million Filipinos suffer from schizophrenia, and 15.3 million Filipinos suffer from substance abuse disorders. 50 million Filipinos suffer from epilepsy, 24 million Filipinos suffer from Alzheimer's disease and other dementias, while 877,000 Filipinos die due to suicide every year. So this was according to the Department of Health in the year 2018. And these numbers are actually increasing due to the COVID-19 pandemic. According to the Philippine Statistics Authority, mental and behavioral disorders were part of the top 50 leading causes of death in the Philippines as of August 2021. There was a 17.2% increase in deaths related to mental and behavioral disorders, not due to psychoactive substance, and 18.8% increase in deaths related to mental and behavioral disorders due to psychoactive substance from year 2020 to 2021. The National Mental Health Program was created because mental health and well-being is a concern of all. It addresses concerns related to mental, neurological, and substance disorders, contributes to the attainment of sustainable development goals. This mental health program includes a wide range of promotive, preventive, treatment, and rehabilitative services that is for all individuals across life course, especially those at risk and suffering from mental, neurological, and substance disorders. It is integrated in various treatment settings from community to facility that is implemented from the national to the barangay level and backed with the institutional support mechanisms from different government agencies and civil society organizations. This program hopes to attain the highest possible level of health for the nation because there is no universal health care without mental health. The Republic Act 11036, otherwise known as the Mental Health Act, has been promulgated to enhance and integrate mental health service delivery to the universal health care through promotion and protection of the rights of persons using psychosocial health services and increasing investments in mental health. The National Mental Health Program ensures the implementation of the law through the National Mental Health Strategic Plan in the year 2019 to 2023, including balanced scorecards with indicators. This affirms the basic right of all Filipinos to mental health as well as the fundamental rights of people who require mental health services. This is the program's vision: a society that promotes the well-being of all Filipinos, supported by transformative multisectoral partnerships, comprehensive mental health policies and programs, and a responsive service delivery network. For the program's mission, to promote overall wellness of all Filipinos, prevent mental, psychosocial, and neurologic disorders, substance abuse, and other forms of addiction, and reduce burden of disease by improving access to quality care and recovery in order to attain highest possible level of health to participate fully in society. And here are the 5 objectives of the program: to promote participatory governance and leadership in mental health, to strengthen coverage of mental health services through multisectoral partnerships, to provide high-quality service aiming at best patient experience in a responsive service delivery network, to harness capacities of the LGUs and organized groups to implement promotive and preventive interventions on mental health, to leverage quality data and research evidence for mental health, to set standards for compliance in different aspects of services. And now let's talk about the program components. First is the wellness of daily living. Promoting, attaining, and maintaining the mental health and well-being of all persons across the life course from pregnancy to old age and in different settings such as schools, workplace, and communities through healthy and effective coping as well as prevention of suicide. For the second one, it's extreme life experience, developing and enhancing resiliency and addressing the mental health and psychosocial needs and consequences of persons, families, and communities that experience critical incidents and events such as trauma, domestic violence, and disasters. So for the third one, we have mental disorders, promoting mental health and well-being, preventing mental disorders, assessing, diagnosing, and treating mental disorders, and improving the quality of life of persons with psychosocial disability through rehabilitation and community integration. For the fourth one, we have the neurologic disorders, promoting neurologic health and preventing common neurologic disorders such as, but not limited to, epilepsy, dementia, and developmental disorders, assessing and diagnosing and treating neurologic disorders, and improving the quality of life of persons with neurologic disorders. Then for the substance abuse and other forms of addiction, promoting protective factors, reducing the factors, and preventing the development of substance abuse and other forms of addiction in different settings such as in the family, school, workplace, community, and industry. Here are some partner institutions of the National Mental Health Program. And for the policies and laws, we have the National Mental Health Policy, the Revised Operational Framework for a Comprehensive National Mental Health Program, and the Mental Health Act. So for the types of service, we have the PhilHealth Benefit Package, Inpatient Mental Health Benefit Package, and also trainings, Mental Health Gap Action Program, Tulong Alalay at Gabay, Community-Based Mental Health, WHO Quality Rights, Harmonized Training Manual on Mental Health and Psychosocial Support, and Implementation Support Material, which is your Mental Health Strategic Plan in the year 2019 to 2023. So for the program accomplishments, we have here the passage of the Republic Act number 11036 dated June 20, 2018, and then the Revised Operational Framework for a Comprehensive National Mental Health Program, then the National Mental Health Program Strategic Plan, and the Harmonized Mental Health Psychosocial Support Training Manual. Then the development of implementing rules and regulations to the RA number 11036 and the conduct of the advocacy activities such as the Second Public Health Convention on Mental Health, observance of the World Health Day, World Suicide Prevention Day, National Mental Health Week, and Mental Health Affairs. Training on Mental Health Gap Action Program, conduct of the National Prevalence Survey on Mental Health, and establishment of Medicine Access Program for Mental Health. So now let's discuss the mental health services in the Philippines. Mental health remains poorly resourced. Only 3 to 5% of the total health budget is spent on mental health, and 70% of this is spent on hospital care. There is a shortage of mental health workers in the Philippines. There are only a little over 500 psychiatrists in practice. According to the WHO and the DOH, the ratio of mental health workers per population in the Philippines is low, at 2 to 3 per 100,000 population. This ratio is lower than in other Western Pacific Rim countries with similar economic status, for example, Malaysia, which has a ratio of 4.9, and Indonesia, which has a ratio of 3.1. According to the WHO in the year 2018, there are 0.52 psychiatrists and 0.07 psychologists per 100,000 inhabitants and 0.49 mental health nurses per 100,000 of the population. This is further eliminated when compared with the World Health Organization recommended global target of 10 psychiatrists per 100,000 population. Further, the majority of psychiatrists work in for-profit services or private practices and are mainly based in the major urban areas, particularly in Metro Manila. There is a National Department of Health Medication Access Program for mental health that carries a central list of essential medications, which are shown in this table. These medications are available at all service levels, but funding issues limit patient access, particularly access to newer medications. The most commonly used antipsychotics in clinical practice are chlorpromazine and haloperidol. Escitalopram and fluoxetine are the most commonly used antidepressants. So for the mental health budget, in the year 2021, we have 615.5 million and each Filipino has a budget of 5.69. And unfortunately, in the year 2022, it has a lower allocated budget, so it's 568.02 million, and each Filipino has a budget of 5.08 pesos. The challenges faced by this program include the COVID-19 pandemic, which led to the decreased budget allocation for this program and the increase also in the affected Filipinos due to the frequent isolation, the required restrictions, loss of loved ones, and jobs as well. Prohibitive economic conditions and the inaccessibility of mental health services limit access to mental health care in the Philippines. Further, perceived or internalized stigma has been shown to be a barrier to help-seeking behavior in Filipinos. There is a strong sense of family in the Philippines, and so, when problems are thought to be socially related, Filipinos will turn to family and peer networks before seeking medical help. And there are only two tertiary care psychiatric hospitals: the National Center for Mental Health in Mandaluyong City, Metro Manila, which has 4,200 beds, and the Mariveles Mental Health Hospital in Bataan, Luzon, which has a 500 bed capacity. There are 12 smaller satellite hospitals affiliated with the National Center for Mental Health, which are located throughout the country. Overcrowding, poorly functioning units, chronic staff shortages, and funding constraints are ongoing problems, particularly in the peripheral facilities. For the calendar of activities, we have here the World Suicide Prevention Day on September 10, World Mental Health Day on October 10, and the National Mental Health Week on the second week of October. Lastly, I'm showing here the different 24/7 helplines nationwide. We have the Suicide Crisis Line and Hope Line. And we also have the Tawag Paglaom Centro Bisaya by Department of Health Region 7 and Vicente Soto Memorial Medical Center, which provides free 24/7 call-based hotline intended for those with suicide and emotional crisis. Here are my references. And let's go back to the case of Juan de la Cruz. That was actually a real case. And the patient was me, but the actor was my brother.
Wow, pogi naman, baby.
My diagnoses are major depressive disorder, moderate with anxious distress, and generalized anxiety disorder, moderate. As an anxious person, I overthink too much, and right now I'm thinking that sharing my story in this report might be too OA, but I'm willing to take that risk. More people need to know that it is a rampant disease, especially now during this pandemic. And as I share with you my story, let me take you to my hometown, Tandag City, Surigao del Sur, where my heart finds peace and rest. I wouldn't wish anyone to go through what I've been through. It's such a dark place that you wouldn't even want your enemies to experience it. It's so difficult to do even the simplest things, such as taking a bath or even taking a deep breath. My bed feels like a magnet. My comfort food doesn't taste good anymore. The activities I used to love doesn't make me happy anymore. Nothing really brings joy, and in all the aspects of my life, I see tons of problems. The littlest problems seem too heavy for me to carry. I tried to cry it out until my eyes no longer open. I tried to pray to God, begging Him to heal me, to allow me to wake up one morning without having that heavy feeling, without feeling constantly afraid. I tried telling my closest friends, but they just chose to be silent, as if they didn't hear anything from me. But I don't blame them, because I know how difficult it is to comfort someone who is depressed, and choosing the right words to say is not an easy task to do. I tried telling my family, but they don't understand. They told me I just need to eat more, and nisaka daw ang kabuhi sa utok. But it's okay, because only those who have depression fully understand what it really feels like. I felt like I've done everything to help myself out of the quicksand I'm trapped in, and I was out of choices. There's no escape, and it seemed like the storm will never end. That's why I often think it's best to just put an end to it. Put an end to this life. I had so many intruding suicidal ideations that I end up literally dreaming about it. Sleep is not my escape anymore. But I thank God for the few people who chose to listen to my never-ending rants about how hard my life is, who chose to be there for me, even if they don't fully understand, who stayed until things got better. Then I just realized that I wasn't alone. I was actually shocked at first when I knew that the people around me were also struggling mentally. At first, They were hesitant to share, but when I told them my story, they then told me how they were really doing and what their feelings really were. I somehow see it as a blessing in disguise, because if I've never had these mental illnesses, I'll never understand them since I've never been in their shoes. And I'm glad that my struggles can be used to help others, to validate their feelings, to encourage them to seek professional help. I am still a work in progress and not yet healed, but I would just like to remind you, my dear group mates, to check on the people around you. This world needs more listeners. You don't have to fix the problem. You don't have to make the person feel okay. You just have to let them know that you'll be there for them. And if we become successful doctors in the future, may we still choose to be kind, because we never really know what someone is going through. And if you're like me, who's going through something tough, don't lose hope, even though it may seem like a never-ending tunnel of darkness. Things will get better in time. They always do. And of course, ask for help. We cannot do it on our own. Reach out to the people you trust most. And lastly, be patient. Be patient with yourself. Healing is such a wonderful thing, and it surely doesn't happen instantly. Remember, all good things take time. And here I end my story and my report. Thank you so much for watching and for listening.